ask as many questions as you want at the end of the session. So kindly drop your name and where you are joining us from in the chat box so we can get started. So while you're introducing yourself, I would like to introduce the panelists for today. I'll be starting with our CEO, Mr. Ifeanyi Aneke, the CEO of CloudClinic with 14 years experience working in the technology industry. He has worked for several IT and financial service companies and helped them build innovative products. His work experience spans across international IT and software companies such as Microsoft, where he worked as a cloud solution architect while covering the Middle East and Africa in charge of the select next-gen high potential accounts in the region. Welcome everyone. Welcome Chikudi, welcome Famchinedu, welcome Stephen Okezi, welcome Adaize Onoa, welcome Adebayo. We are very, very glad to have you. So I'm going to be continuing with the introductions. I'm going to be introducing our second panelist in the person of Flourish Unamde. Flourish is our product manager with over 5 years experience as a business developer and product manager in the financial services industry. He's certified in product management and digital payment by Lafferty Group and holds a Bachelor of Science in Economics from Landmark University. Thank you very much, Flourish, for joining us today. I'll be moving on to Amaka Ezekwesili, our program coordinator with a blend of experience that cuts across several industries. She has worked for 10 years in the construction industry, a year in the finance industry, 3 years in the business sector, and 2 years in the manufacturing industry. I'll be moving on to our dear clinical director, Dr. Amy Ojiako, who has over 6 years experience in medical practice and 4 years as a health management consultant. Dr. Amy is certified in clinical management of HIV from the University of Washington in the United States of America, and she's also certified in leadership and management in health from University of Washington. She has an MBBS, a Bachelor of Medicine, Bachelor of Surgery from the University of Nigeria, Nsukka. And my humble self, a lot of you know me already. I am Ololade Olale, and I will be your host for today. Thank you very much for joining us. Thank you once again. Please note that we'll try to attend to all of your questions at the end of the webinar. But during the webinar, so you don't forget your questions, you can just drop it in the question and answer segment. There's a question and answer box just below that you can type in your questions, and one of our panelists will jump right on that. Okay. Thank you very much. For those of you that are just joining us, welcome to CloudClinic Fast Pharmacy Onboarding Webinar. So without further ado, so we can just get started, I would like to hand over to my CEO, Mr. Ifeanyi Aneke, to begin the session. Thank you.
All right. Thank you very much, Lola. I want to say good morning, everybody. Welcome to our very first pharmacy onboarding event. So I see that there are still some people joining on the attendee side. We'll have to start pretty quickly. So that's because this is a Monday and we know some people are going to be busy today. So we'll get started. And then at the end of this, we will be sharing the slides and the recording of this webinar to everybody invited for this. So even those that might not be here on time, shouldn't be an issue. They can always pick this up much later. So, all right. So we can get started. So I'm very excited to have everybody here. Very excited that we have a lot of our pharmacy partners, some people that are already partnered with us and prospective partners as well, present with us here today. Can you go to the next slide, please? So I'm going to be talking about some of the main things we plan to do today in the agenda. So a couple of things. We're going to be looking at some introduction about the company. I'm going to tackle that. I will also look into who exactly is a partner, a CloudClinic partner. What does that mean really in its sense? And then we'll talk about the benefits that partners have. Then we'll talk about, introducing the CloudClinic partner app that will be handled by Flourish, who is our product manager. After which we'll go into the house rules. Dr. Amy Ojiako would handle the house rules, the partner house rules, which is a couple of questions, or rather a couple of rules or sort of guidelines that would set around to help us make sure that the community we are building is very healthy and is very, working exactly the way we planned it to be. All right. So, and then there's also going to be a couple of onboarding process guidelines as well, and then the question and answer session towards the end of the whole process. So, having said that, let's get started. All right. Can you turn to the next slide? Seems to be some lag here. Okay. All right. So what is CloudClinic? CloudClinic is a medical platform that connects different players in the health industry, but providing a solution that works for doctors, patients, and health facilities alike. So essentially what we're doing is that we are orchestrating the interaction between different stakeholders in the healthcare sector. And the way we're doing this is using our technology solutions. So we're allowing patients to be able to book virtual consultation with doctors. At the same time, we're also making it easy for those patients to be able to connect to a pharmacy close to them and pick up the drugs that were prescribed to them by a doctor. At the same time, we're also working with med labs and reference hospitals as well. So essentially using technology to make this whole process easy. The reason why we're doing this, which talks about our vision for CloudClinic is really to provide access to quality healthcare to everyone anywhere in Nigeria. And I know this is a very tall dream. To provide access to quality healthcare to everyone anywhere in Nigeria is not an easy task to do, but we do believe this is possible. We believe that with the technology we're building, that is very possible for us to be able to do this. So a lot of work that we're doing with building user interfaces and user applications and apps and smart devices that work seamlessly and they allow patients to be able to connect from anywhere they are, makes this really possible. In the same way, the technology of the internet is growing. We know today about Starlink internet that gives anybody anywhere in the country and anywhere in the world really access to internet, makes this even more possible. So we do believe this vision is possible. Our mission, which talks about how we plan to achieve this vision, is actually engineering the future of healthcare with focus on access and convenience through technology. So a lot of the work we're doing in our research office in Lagos, Aja specifically, Lekki Scheme 2 is where our office is. We have a research office there where we're working with different engineers, AI engineers, software developers, figuring out how we can solve this problem of making healthcare accessible and convenient. Next slide, please. So, having said that, having talked about our vision of providing healthcare access to everyone anywhere in Nigeria, and then also talking about how we plan to do that using technology, what are the services we're providing today? So the first one of them is the fact that we're currently riding on a very robust cloud infrastructure. We provide a cloud infrastructure that is able to provide these services to people and is free from defect and is highly reliable. So there's really going to be very little issues if it even exists, where you'll be hearing things about, downtime of our application, because we're running a very robust infrastructure. Our service also relies on smart devices. So we're making it possible for anybody, any patient at all, irrespective of their age, will be able to use these devices because they are quite easy to use and not difficult at all. So a doctor needs to be able to understand the vitals of his patients. And these devices makes it easy for that to happen without any problem. We also understand that for us to be able to provide this service, we have to blend the physical, with the online. So, and that's where our reliability on our GPS technology helps. So when a patient finishes consulting with a doctor and the doctor prescribed a drug for that patient, we use our GPS technology to guide that patient with turn-by-turn navigation straight to where the pharmacy is. So there is no issue of him getting lost. He knows exactly where to buy that drug because we've synced your inventory as a pharmacist that's partnered with us with our online platform. So we know when you have the drugs and we guide the patients to go pick up the drug from the pharmacy closest to him. Of course, this is where you come in, licensed facilities. We're working with only licensed facilities, licensed pharmacies, licensed medical laboratories, and also reference hospitals as well that are licensed. So there is clarity that we're providing the top-notch, well-standard medical services to our users. And then the specialist services are also available on our platform. So we know what happens a lot when a patient goes to a hospital, and a lot of our hospitals don't have all the specialists, except you're going to a teaching hospital. With CloudClinic, access to specialists becomes on demand. We have a lot of specialists even signed up today. We have over 100 doctors that are actually over 190 pre-registered with us already, and a couple of them have started the onboarding process today. And with all these doctors on our platform, some of them are consultants, some of them are, GPs, some of them are different specializations, really. So it becomes really easy for any patient to be able to get access to these services without any problems. Next slide, please. And now let's talk about our partners, which is where you come in. Our partners are our strengths. CloudClinic is a cloud-based solution that is integrating with the real world through the partnership we have with you. We can't exist without partners. So on this screen is some of the partners we've partnered with today. And we're currently starting the activation process for these partners against our launch date in April 18th. And we're also looking for more partners to be able to reach out because our plan is to cover the entire square foot in Nigeria. And to do that, we can't do that without these partners. You are our strength. Our partners is our representation in the last mile. So we need to be able to work with you to create that mutual, beneficial and business environment where you benefit and we also as CloudClinic benefit as well. Let's go to the next slide so we can talk a little bit more about the benefits or who exactly our partner is. Next slide, please. So the question is, who is a CloudClinic partner? A CloudClinic partner is a member of a CloudClinic directory of partners. So in this case, it will be licensed pharmacies. And this really helps with brand recognition of these partners. The partners that are working with CloudClinic are listed in our directory. So a patient that is looking for a pharmacist to work with or trying to buy drugs will be able to trust and say, hey, this pharmacy is licensed because we only work with licensed pharmacies. And that helps with your brand recognition. There's also increased trust, which increases, customer retention, for our partners. Every partner working with us, clearly with the brand recognition that is available, you being a partner, that also goes in, handy to help with increasing your brand awareness and recognition. There's also reputation and credibility that is also there. You become a little more reputable because with our network of patients, even before we've launched, we're planning to launch on the 18th of April, before launch, we have patients already lined up, interested in what we're trying to build. And clearly these patients would want to work with you because of this, because, they already trust us. They already have clarity on that, the people, kind of partners we're working with, and this would definitely help with your credibility as well. Our partners are those that also, adheres to international best practices of standard healthcare delivery. We work with partners that we are confident that they will be able to uphold CloudClinic's high standards in healthcare. We're looking for mutual support system as well. Our partners who work with us, we see you as a partner. We understand clearly that partnership exists. So it's not a situation where we're just, it's a one-sided thing. No, we're constantly looking for ways to improve the process of our partners. Our system today is not, we have some features that are great for partners, but we're building even more features down the line. There's the inventory system that we're working on that will eventually even integrate with the existing partners' inventory system, or it would be a replacement for them if the partner decides to go with that. And in the same way, there are a lot of systems, a lot of things we're building to really enhance the ecosystem and make our partners much more comfortable to work with us. And there's also networking opportunities as well as partners, right? There's a lot of networking opportunities as partners that we're working with that will help with this whole process as well. Of course, a partner must be licensed, with appropriate bodies, in this case, PCN. We don't work with partners that are not licensed. Yes, you can go to the next slide now. So one of the things we've already talked about is this issue of the benefits. So we talked about visibility. That is a big one. There's a lot of pharmacies, that are struggling with being able to get the right visibility, get the right people to your room. Even if the ones that are there, you want to get much more. The right patients, the right people coming in, walking into your doors. What we're doing is that we're not only are we providing that visibility, we actually refer patients directly into your facility to come buy drugs from you. So that's definitely something that we're doing actively. Okay. Next slide. With increase in visibility and increase in the referrals we're sending to you, comes increase in revenue, and that's by default. So we expect that our partners will see a significant increase in their bottom line because of this partnership with us. Next one. Now, at the same time, we are also building a payment system within our platform that makes it easy for our partners to be able to receive payment, in a seamless way. So every patient referred to your facility to buy drugs from, that is a CloudClinic patient, we make sure that as soon as we receive your invoice at the end of the month, you get that remitted to you within 72 hours, as contained in our contract agreement with our partners. So this is definitely something that we are very mindful of. Next slide. Now, we also provide wire client entry. We talked about the GPS technology that we're doing, the facility, where that works and how that is helping really drive a lot of functionalities around making sure the patient is able to find you. No longer would it be only those that know you. You can now work with a lot of patients that are directed to you, even those that are new in town that know about you. Even if your facility is not like in a very lovely location, like it's not on the road, these patients will be directed to you and they can find you with our GPS turn-by-turn navigation that we built into our system. Next. All right. So at this juncture, I think that is the very high level of the benefits for partners that I've highlighted here. I'm going to turn over to Flourish. Flourish, are you ready to take on talking about the actual details of the application? Flourish is our product manager. Are you ready, Flourish?
Yes, I am.
All right,
yes,
I'll turn over to you, and then I'm going to be here still for questions and maybe coming towards the end of the presentation. But I'm really excited about this opportunity to work with you as partners. Thank you and welcome.
All right, thank you so much, sir. So I'll go quickly to introduce the CloudClinic partner application. All right. I know majority of you would have asked questions that, okay, if you built this wonderful solution called CloudClinic, how exactly do we partner with you guys? Where exactly do we come in? Or what do we need to do, to ensure that we have, a smooth partnership with CloudClinic? Now I introduce to you CloudClinic Partner App. The CloudClinic Partner application orchestrates communication or interaction between you that are our partners and the CloudClinic app. Essentially, we communicate securely and seamlessly, thereby ensuring convenient access to healthcare services by our patients using CloudClinic. I would also explain this further. What we've designed and what we've launched out there in the market is an easy-to-use application that ensures that our partners, irrespective of your location, can communicate securely and seamlessly, to the CloudClinic app, offering the product and your services, on that app. I'll move to the next slide. The next slide speaks on part of the things that you can do with the partner app, which is the facility activation. One of our key features and benefit of the CloudClinic app is, irrespective of your location, we can connect it directly to a partner facility, that is a partner pharmacy in this case. All right. Using our CloudClinic app enables you to communicate precisely your location to CloudClinic by capturing specific areas or specific angles of your facility. What that means is, when you have the CloudClinic app, all you need to do is launching that app, just certain areas of your facility that you would need to capture using the app, and it communicates the exact coordinates of where your facility is. This enables you activate your facility on our platform, and at the same time, once that is activated, we can now route patients to your facility irrespective of the location. Through this means, CloudClinic efficiently connects her patients to your facility's location real time. I'll move to the next slide. Now, the next slide speaks to your inventory upload list. We understand that as a pharmacy, you have a long list of inventory that consists of or contains your drug list, the prices of your drugs, the kind of drugs that you have. We've built an easy solution that enables you upload your list on the app. So you're uploading your list in an Excel format, and it's a secured channel, so that once you're done activating and capturing certain angles of your facility, you can upload your drug list on the app. Also, we've made this process easy, so that you don't even have to start looking at converting the exact kind of document that you need. So with our easy format, you can just upload your Excel price list on the CloudClinic app. Moving to the next slide, still on that same inventory upload, we've made our solution flexible enough so that you can bring your own templates. All right, we've created this solution, and we've made it intelligent so that we are saying, bring your own templates. You don't have to modify anything. All you have to do is just ensure that the headers capture the the brand of the drug, the drug type or the generic name of the drug, the formulation, that is if it's a capsule or or an injection, and the price. So all those columns are just properly captured, and we say bring your own template. Our system learns the templates that you provided and matches it with what we have, and you can use that same template for future uploads, even if the price is changing in the markets. Now, the next slide is the price updates. All right. We've also created our system flexible enough so that even on the partner app, all right, you can update the prices of the items that you've uploaded. So for example, if I have pharmacy XYZ that uploads a particular drug, all right, the pharmacy XYZ can still visit the CloudClinic app and modify the price of that drug without having to even change the template. If you decide to upload a new template, we've designed a robust web solution so that you can easily match the conflicting items that have been uploaded from your template to our system, and you save that real time. All right, then I think I'll move to the money matters. I'll let the clinical director handle the aspect of the money matters concerning our partnership with pharmacies. Thank you, everyone.
Thank you. Thank you, Mr. Flourish. Good morning, good morning, everyone. Our dearest pharmacists and the pharmacy representatives present. I'm Dr. Amy, as rightly introduced by Lula. I want to especially thank the Chief Executive in the person of Mr. Ifeanyi Aneke for introducing CloudClinic, and the product manager in the person of Mr. Flourish Nnamdi for introducing the app. So I would continue on the already existing protocol to discuss what a prescription looks like when a patient comes to your facility. So looking at this slide, we have the prescription list. The very first one, the one that is bigger, is the prescription list that was sent to your email. And then the smaller image is the prescription list that the patient comes with to you. to pick up medications. So you do not have any worries as to if the patient has paid, because we're not sending a mail containing prescription list to you that the patient has not paid for. So if you're looking at this prescription list, it's already tagged paid. So you don't have any worries. The patient has paid for the medications, and the patient is coming to you, and you're dispensing the prescribed medications to the patient. That is to say that the patient cannot decide to buy a medication that the patient has not paid for using our app or using CloudClinic, all right? So a patient can also come to you and request for any other medication outside this list, but it's now outside CloudClinic business. And of course, we all pharmacists, we know that we can't dispense a medication that is not prescription medications. So any medication that is outside the prescription medications that must require doctor's prescription, you're free to dispense to the patient. So that's it on the money matters issue. Moving on to the main topic for me to discuss. Mr. Flourish, can you confirm where I'm at my slide?
Okay, you're still at money matters.
Okay.
You can move.
I'll move to the house rules, right? Thank you.
Yes.
Yep. So the house rules are basically, we have some rules we developed for our partners, okay, because we all know that there is no house that exists without rules, organizational and legal structure, guiding the system, so that we all play by the, by the rules, by the acceptable, standards. The whole aim is to deliver a world international standard of, healthcare to our patients, and healthcare includes the health products that we are giving our patients. By that, I mean the pharmaceutical products and also the non-pharmaceutical products, medications, and the rest of them. So these house rules are mandatory for pharmacies and have been prepared to assure you, the pharmacies, the partners, of your rights, while creating the most favorable platform for best healthcare service delivery. So we've categorized these house rules into different categories. We have the house rules on licensure. Like the chief executive mentioned, we're only partnering with licensed pharmacies, right? Because we've set a standard in CloudClinic and we must go by this standard, right? So it's important that you, as our partner, the pharmacy, must be fully registered under the Pharmacy Council of Nigeria, PCN, and of course the Ministry of Health. Ensure your practicing licenses are renewed when due. Whenever your licenses are due for renewal, by all means, it will be in our best interest to renew your licenses. We are working with pharmacies. We are not working with patent medicine stores. I believe there's a difference between these two. We are working with pharmacies, not patent medicine stores, right? So, and there is no pharmacy without a pharmacist, a licensed pharmacist attached to it, all right? So it's important that the practicing licenses of the registration for the pharmacy as an organization is intact, and then the license of the pharmacists that is working in that pharmacy is also renewed when due. So now moving on to identification. The affiliate pharmacy must identify CloudClinic patients from the information sent to the facility. I've already showed us the email we would be receiving even before the patient arrives, all right? So with that email, the email contains, the prescription list contains the patient's name, the patient's sex and the age, and even the information on the doctor that prescribed the medication. So you're equipped with every information you would need to identify that this patient is coming from CloudClinic Limited. So moving on to prompt service delivery, the prescriptions that have been paid for will be clearly indicated in the email sent to the pharmacy. And of course, we are sending only the prescriptions that have been paid for to you. The patient can come with the prescription that contains the medications that have not been paid for, all right? So with confirmation of patient's identification, we encourage you to render your services without requesting for any payments anymore from the patients, and render prompt service to our patients, because by extension, you as our partners are also our image makers. You are our ambassadors. And if our clients, our patients are not receiving prompt service, then it will tell on the company as a whole. So we encourage us to deliver prompt services to our patients once their identification is confirmed. Okay, so the next is quality medications. It's important that our affiliate pharmacies must provide quality medications or other non-pharmaceutical products to our patients without unnecessary delay. It's very, very important, because being a licensed pharmacy, it shouldn't be allowed that you are dispensing medications without quality, fake drugs. We have issue of fake drugs ravaging the country and even outside, right? So it's important to know that we are partnering with only licensed pharmacies, and then licensed pharmacies are not pharmacies that should sell medications that have no quality, or fake medications, or substandard medications. Okay, so bearing that in mind, we've come to you to partner with us, and then we are coming to you with the confidence that you're giving our patients the best. Okay, so moving on to ethics. The affiliate pharmacy must practice within the ethical guidelines provided by the appropriate authorities, the Pharmacy Council of Nigeria, any other authorities that is governing the pharmacies and the healthcare service delivery that they render to patients. All right. So this webinar wasn't just for or isn't just for the pharmacies. There was a webinar for the doctors, for the lab scientists, medical lab science facilities that we've partnered with, and we made it clear that we all in the healthcare system or sector must abide by the guidelines, the provided guidelines for our practice. So we as doctors, we're giving standard healthcare. The med lab scientists are also giving standard healthcare service in terms of the investigations they're running for our patients. And then of course the pharmacies are also giving us standard healthcare as regards to the medications that they are giving our patients. All consents of the affiliate pharmacy must be mailed to partner support at cloudclinic.ng. So the house rule on money remittances, I am happy to inform us, just like the chief executive also mentioned, that 3 business days to the end of every month, an invoice for all services rendered should be mailed to CloudClinic Limited for remittance of funds. Okay, and as indicated in the partnership agreements, which we both signed, within 3 days, all payments are expected to be made, and the agreed markup or rebates will be deducted from the funds and then the balance remitted to the affiliate pharmacy. Okay, the next is on confidentiality. We are in the health sector, and the basis of our practice is confidentiality, right? So it's important that the affiliate pharmacy must respect the patient's right to confidentiality as stated by law and in the partnership agreements. Okay, so the next is hold on, please, just a moment. Activation of.
Yes.
Yes, Mr. Flourish, would you want to?
Yes, so I can walk you through. So we have the customer onboarding, the customer journey for activation of the partners. So this just itemizes the steps that as a partner you need to take to activate your facility, The first is to download our partner app, which you can get at get.cloudclinic.ng/CloudClinic partner. We'll be dropping that link. In the chat room for everyone to download the app. Secondly, you provide your facility ID. Your facility ID will be sent to your email once you've been created on our system. So we create our partners on our system, and once you're created, you receive an ID which you'll use to log into the partner app to activate your facility. The next step is to ensure that the information displayed to you on the partner app is accurate. So one of the things we do is that once you want to activate your facility, we display to you brief information about the facility for you to confirm that it's correct. Once that has been confirmed, you provide an email address that will be used to receive OTP, which is the number 4. Provide an email address that will be used to receive the OTP. That email address will be used whenever you want to log into the app to receive your verification code. Once that OTP has been received from the email, you put in the OTP into the app, and you start the activation process. So the activation process will require you, as earlier explained, to capture certain angles of your facility, which also includes the front of your facility, the reception area of your facility, and also 1 or 2 equipments of your facility, inclusive of the shelf of the drugs that you sell. Also ensure that once you've taken the appropriate pictures as displayed in the partner app, you also grant permission for the app to get your precise location. Once that is done, you move to the next step, which is number 7, to upload your price list. So your price list will be in an Excel format, and you also append the appropriate columns, which includes the brands of the drugs that you sell, the formulations of those drugs, if it's capsule or syrup, then the prices of those particular brands. You upload that in an Excel, and also the generic name. You upload that in an Excel and you submit. And once you submit that, that process is complete. There is also a video which I'm going to play next that is also going to explain to everyone in detail the steps on how to activate your facility. Okay.
Here's a quick guide to get started using the CloudClinic Partner app. Download and install the CloudClinic Partner app on your mobile device. Enter the facility ID sent to your email upon facility creation and hit Submit. Confirm that the information on the next screen is correct and is related to your facility. Proceed to the next screen to enter the facility operator email and verify the email with the OTP sent to you. Upon validation, proceed to grant camera permission. Then capture the front of your facility, reception area, and other relevant equipment. Ensure you grant access to precise location while using the app after uploading your facility images. Next up, grant permission for file access, then upload your pre-filled price list. Check the top of the price list screen for upload conflicts notification, if any. Proceed to resolve the conflict by selecting from any of our suggestions or indicate can't find. Click on Yes at the lower part of the screen if you wish to continue on a web browser. Check your mailbox for the unresolved price list email. Lastly, Click on the link in the mail to update your price list. Remember, you don't need to re-upload your price list. We've got you covered, as the app saves your upload. We look forward to welcoming you on board.
All right, thank you, Dr. Amy.
Thank you, Flourish, for the video. Okay, moving on to, could you let me know the pointer map you can see? The links.
Yes, you're on the links.
Okay, thank you. All right, so we have the link to the house rules in details, which can be found here. And we also have the link to download our partner app. And then we have the link to apply to be a licensed partner. So I'm sure if you've not partnered with us by now, you actually want to partner with us because, I mean, like the chief executive mentioned, there is mutual support system. It's a win-win for both parties, and it's going to be an interesting journey. Over time, we've noted some questions from our partners, and it's important that we discuss them in details here so we can understand everything, every ambiguity, have all the clarity, you know, all our questions, all the questions bugging our minds, have them answered, and then we can have every assurance that we need for this partnership to work. So, the first one, when will I get paid for the medications I give to the patients? The patient pays for each medication before dispensary, and the total fund remitted within 72 hours of receipt of invoice at month's end. So within 72 hours of receiving your invoice, you would have your money already remitted to your account. How will I get paid for the medications I give to the patients? CloudClinic will credit your submitted corporate account once an invoice is submitted and processed. How will I recognize a patient from CloudClinic? A CloudClinic patient will present a CloudClinic prescription form, and the form will contain the details sent to your email. To say an error there, it should be a prescription list or form, which will, and then the prescription form will also be sent to your email for more verification and confirmation of patient's identity. How do I update the price list? The price list can be updated through the CloudClinic Partner app by updating them one by one or uploading the new price of the tests using an Excel. What happens when a patient wants to procure a medication outside the prescription list? Any patient reserves the right to request for medications that are not prescription medications. However, any prescription not marked as paid won't be paid for by the patient. So like I already mentioned earlier, you are free to dispense any medication that the patient might request for, you know, that is not in the prescription form. So for us, it's not a prescription medication, okay? And that medication will now be paid for on the spot by the patient. How frequently do I receive my money as a CloudClinic partner? CloudClinic pays her partners at the end of every month. It's an automated system. So at the end of the month, you have your funds remitted to your account. Must I upload my price list on the CloudClinic Partner app? It's a big yes. However, the app allows you to use a desktop browser to resolve conflicts during the upload. At this point, we'll take the questions from the audience, and I would also want to use this opportunity to thank you all for listening and thank you all for your time. And I also want to project our social media pages that you can connect with us using to provide more information on CloudClinic and our products. We are on Instagram, CloudClinic Limited. We are on Twitter, even Facebook, WhatsApp. We have our WhatsApp contact number, and we are on LinkedIn too, CloudClinic Limited. And then we have our email, support@cloudclinic.ng, and finally our website, www.cloudclinic.ng. So at this point, our launch date is on the 18th day of April 2023. And we are, we are very much expectant. We are eagerly looking forward, to the date, and we have been working hard to make sure that we bring a product that works for all of us and that you as our partner will enjoy with us, even as we work together as partners. Thank you all for listening. I would, pave way for Lola, right, to take over and manage our questions. Thank you all for listening.
Hello, everyone. Thank you very much for staying till the end of the session. I hope the session has been illuminating. For those people that have called at one point or the other to tell them about CloudClinic,
Okay. It looks like Lola might be having some issues with connectivity where she is. Can anybody hear me? Dr. Amy, can you hear me?
Yes, I can hear you, sir. Can you hear me?
Yes, I hear you. I think there might be some connectivity issue from Lola's side. All right. So we are currently on the Q&A side of things. So I think there are some questions there already. Some of them have been answered. Yes, Flourish, we can hear you. So somebody is saying, I want to receive my money weekly, not monthly. Okay. All right. So it's an anonymous attendee, so I don't have the person's name. I can try and answer this. I know Amaka is already trying to respond to this. But yes, so we have looked at this. We've kind of consulted with different stakeholders in the industry around the best way to do this, right? And we've decided that the best way for us to do this is to handle this on a month-to-month basis, based on those consultations that we've had. And this is not to say that this is it's just to make the whole process easy for us. We're partnering with possibility of partnering with thousands of pharmacies and med labs and different partnerships going on. Being able to handle the accounting and remittances on a weekly basis or anything less than monthly will be a nightmare for us. And that's why we're going with the option of monthly, really. But we're happy to have a conversation with you to see why this weekly is super important to you and how we can work with you to make this something that works for everybody. So thank you, anonymous attendee. I think there's another question as well. Lola, I see you're back. Maybe you can take over and call out the questions, and then we can take this one by one as they are coming in.
All right, thank you very much. Apologies for dropping off abruptly. All right, so someone said, I thought I had payment within 72 hours. Please confirm payment is 72 hours. Monthly is not fair to pharmacies.
Okay. Yes, so I think it's the same conversation. The monthly 72 hours is after an invoice is received. So what we are talking about is that all the payments that is done, the drugs that are dispensed within the month, you will get an invoice from your pharmacy towards the end of the month. And once you receive that invoice, you get your money within 72 hours. But it's monthly. However, like I said, if this is an issue, we can definitely look at how we can work this out with you to figure out the best way to handle this.
All right,
Lola, are you still there?
Yes, okay. I am. All right. So there's another question here from Afolakemi Good. Okay, so no, it's not a question, it's a comment, and it's still around what we are talking about currently. She says monthly remittance is not doable due to cost of funds for doing business in Nigeria.
Okay. All right. So I think it seems like this is a major concern for our partners. What we are going to do is we're going to look at this. and then figure out how we can work with you on this. I don't think this is going to be a major issue. We can look at how we can figure out an easier way to make this happen. So yeah, we can talk about that. All right. Seems like some network issue from the last side as well. I'm going to read this out myself. I see a question here from Stephanie Okezie. We say, where she's saying, how would CloudClinic attend to patients that may need physical examination and also patients that may need to be touched, etc.? That's an excellent question, Stephen. So a couple of conversations around this have been going on. Like I said, this whole idea started about 9 years ago when we started this whole conversation on figuring out the best way to build this system. We've looked at what have worked for other people outside the country and the mistake that people even within the country had made trying to build a solution like this. So we've spoken to a bunch of people. We've had a lot of consultations as well with different stakeholders in the industry, pharmacists like yourself. We've spoken to regulatory bodies, we've spoken to doctors. Those are some of them that have been in practice for many, many years. And we've part of the things that came up throughout all those conversations was also the talk about this touch. How do you handle physical examination? And what we've factored in is that physical examinations will be requested the same way a doctor is requesting for any other investigation, right? It's really an investigation. So if a doctor thinks that he needs to examine a patient physically, we have partnerships with other doctors on the platform that are, that can do those examinations using their reference hospitals. So what will happen is that if a doctor in Enugu is examining a patient in Lagos, and then he feels that he needs to do a physical examination of that patient, he will request an investigation, and then that patient will be directed to a doctor close to him to perform that physical examination, and the result will be uploaded back into the system, and the doctor can continue his investigation or continue his consultation with that patient. Just the same way a doctor can request a malaria test as well. So that's how we are getting that done today on CloudClinic. All right.
All right.
Okay, you're back. Go ahead.
All right. Thank you very much, sir. There are other questions now. There is one that says, okay, a lot of these questions. Okay, do prescriptions come with branded costs? And if you don't have the brand, can one dispense another of higher or lower pricing?
All right. So what we are doing is that we are going to be, as part of the process that we have today, there is, if you've watched the video, Flourish, the product manager, showed clearly how we are built a very intelligent upload system for you that makes it easy for you to upload your price list you have on Excel sheet, or you're exporting from your inventory system into our platform. And then it's smart enough to learn what your template is. So we're not coming to tell you to go and start changing your template to abide with our own process or our own schema. The system is smart enough to work with your template. You just need to tell it which of these columns is a drug name and what have you. So we're actually capturing your brand names, and we know what you have in your store. So when a doctor is prescribing a particular drug, he's indicating the brand name he wants the patients to buy, and he has an idea of which of those pharmacies close to that patient have those drugs. So when the patient is coming to you, he's coming with a particular brand that you have. So there is no issue of you having to make that decision in the first place, because it's going to be the one that you have, and the price of that drug has already been paid by the patient even before coming to you. Now, there are cases where a patient didn't pay online. Maybe for some reason the patient, maybe his card didn't work or something, and he decides to download the prescription and walk into your pharmacy to pay physically. In that situation, you would see the brand name, the generic name, and then you can make that decision just the same way you would make it if someone walks into your store. So it's not a must the patient must pay through our platform. And if the patient is a walk-in patient, then we don't require the rebate or the discount in that case. You treat the patient the same way you would treat a walk-in patient.
All right, thank you very much, sir. I hope that answered your question. Someone left a suggestion in the chat box and said, what about the idea of creating a wallet? That's from Lucky Waji.
Yes, so that's something that we're looking at today for pharmacists to be able to, for that to happen. We don't have that functionality today, and then it's definitely something that we can look at so that it will take care of this issue of payments, being able to get your money immediately. If pharmacists have wallet system on our system, if we build that in, then you can withdraw the money at any point once the money is credited. So there won't be any issue of having to wait till month end and start doing reconciliation. So that's a great idea. It's something that the engineering team actually plans to implement post go live, and we're looking at that, and we might need to speed that process up based on the feedback we're getting. It seems like most of the pharmacists here feel like the cost of business, it won't allow them to wait till month end to receive their funds. So we're going to definitely review this with the team and figure out how to step up that process of building a wallet system for pharmacists on our platform.
All right, thank you, sir.
That's a good one. That's a very good one, Lucky.
All right, thank you, sir. Someone made a comment still around the monthly payment conversation. He said fortnight payments can't it be okay? I think there's a typo. The person is saying can't the payments be made fortnightly, especially for high volume prescriptions?
Yeah, so I think it's still the same thing about frequency of payments, monthly being something that is not very favorable. We definitely noted this already. We're going to work on this. We're going to speak to the team and figure out the timeline to implement our wallet system for pharmacists. Thank you, Chukwudi.
All right.
Lola, I think there are some questions on the chat. Maybe you can look at those ones as well.
Yes. The question I want to read now is from the chat. Afolakemi Good says, are pharmacists able to reach out to the prescriber if there is any reservations on the prescription?
Say that one more time.
Okay, she says, are pharmacists able to reach out to the prescriber if there is any reservations on the prescription?
Right now, no. The system doesn't have a way for that to happen, for the pharmacist to be able to reach out to the doctor. We have a way to know who the doctor is as required in any prescription document, but there is no way for a pharmacist to reach out to a doctor to say, hey, why did you prescribe this or that? Now, the reason why we didn't prioritize that feature because we have to make decisions on what we're building first and what we're building afterwards, right? The reason why we didn't prioritize that was because we looked at the reason why that happens a lot of times in hospitals and even with pharmacies is from our analysis. It happens most of the time when a pharmacist is trying to provide alternative options. So a doctor prescribed a particular drug and it's not available, and then the strength is not there, and things like that. And the pharmacist might want to confer with the doctor to say, hey, I don't have this, are you okay if I give this instead? What we've done to counter that in our system is to make it visible to the doctor what is available in your inventory. And so you reduce the necessity for that considerably. However, if you feel that this is something that you would need to be able to do your job well, it's something that we have planned in the pipeline down the line.
All right, thank you very much. So most of the questions in the chat are still around the monthly remittance. Earlier, Afolakemi Good says that is the decision to remit funds at the end of the month debatable?
Yes. So we've already mentioned that we're going to review this. This is clearly a feedback coming from a lot of people on this. We're going to be reviewing this. We have something planned, like I mentioned earlier. We have a wallet system planned for this. However, it was deprioritized because we had other things that we needed to do before go live. So what we would do is that we're going to speed that process up and figure out a way to implement a wallet system faster than we planned initially based on the feedback we're getting here today.
All right, sir. Thank you. Okay, so Dr. David says, is there a feature that will allow professionals flag possible interactions, dosage inadequacy, and other medication concerns?
Okay, so there is no communication today that exists between pharmacists and doctors that prescribe the drugs today. However, like I mentioned, this is something that is planned. It doesn't exist today, and we have reduced the need for that by making sure the doctor have clarity on what is obtainable in the pharmacy. In the case of drug interactions, to some extent, some of these doctors are working with drugs they already know, so they might know those drug interactions in question. But right now, there is no way to do that. We'll plan to implement that functionality down the line, but it doesn't exist today. But very good feedback. We're going to make sure that we'll speed that particular feature set up as well.
All right, thank you very much, sir. Farm Darlington says, in case of drug interactions or wrong prescription, what should the pharmacist do since the physician is unreachable?
Yeah, so we have a way to reach out to us. There is a way to reach out to us on the partner app, but you're reaching out to CloudClinic, not to the doctor directly, unfortunately, as of today. So you can reach to us using the app, using the feedback section, or you can email us at partnersupport@cloudclinic.ng.
All right, thank you. Afolakami Gold, okay, she has 2 questions. She said, is rebates or deductions monthly fixed across all pharmacies? And the second one is, are patients picking up their medications themselves from the pharmacies?
Very good questions. The first one, yes, the actual rebate figures are fixed to a large extent. We've had situations where we had to make some on very rare cases. We've made some concessions based on certain understandings, and some of the cases because the relationship we're having with some of those facilities are a little deeper than what normally happens. So, but it's fixed, more or less, at the time across board. However, the pharmacies or the pharmacies and the med labs and the reference hospitals fix their own prices. We don't fix prices for you. So you determine how much you sell your drugs or your tests and also your procedures in the hospitals. So that's the answer to the first one. The second one is not a yes or no, unfortunately, or actually fortunately. Patients can pick their drugs from their medications from your facility, from your pharmacy, but also for a select number of pharmacies that provide home drug delivery to patients, we also have that in place. So what we are doing is that for those ones, we are doing that based on catchment area. So for pharmacies that are interested in doing a home delivery, there are certain criteria that needs to be met before we allow that, because we need to be sure the infrastructure is in place to be able to deliver those drugs on time. And there are certain SLA document that needs to be signed. So we're open to that. There are a couple of pharmacies we're working with already on that, but we'll still have a lot of catchment areas that are open. So if your pharmacy is interested in doing home delivery and have the facility to do that, maybe is already doing that today to some level, we're happy to partner with you to give that option of increasing convenience to our facility or our patients. So that's definitely one thing that happens. Definitely for those patients that need the home delivery of medications, they pay a little extra for the logistics of that. And those details can be discussed with anybody that is interested in going with that option as well.
All right, thank you. I hope your question has been answered. Afolakemi Gold. Okay, so there's another question from an anonymous attendee. Says, can a pharmacy a drug that was not prescribed? I think the person is trying to say, can a pharmacy give the patient a drug that was not prescribed?
Yes, if that's the question, then the answer is yes. So a pharmacy can dispense drug to a patient that is beyond what was prescribed in the CloudClinic prescription form. That happens. The same way a patient can walk into you to say, hey, give me some drugs. we can also do the same thing. You're free to do that as well. And for those ones, we don't expect that you pay any rebates to us because it's captured directly as if the person is a walk-in patient. Of course, you know that you will only prescribe those, you will only, give those drugs to the patient if it's not a prescription medication. If it's something that requires prescription, of course, you must make sure that you get that done because that's what the law says.
All right, thank you. Anonymous attendee, I hope your question was answered. Okay, Afolakemi Gold has something to say about pricing. She says the deductions has to be added to the price imputed in the Excel spreadsheet. I think this is a question.
Yes, it seemed to me like it's a question, Lola. So Afolakemi, it seemed to me like what you're asking is, should you be imputing the deductions? Like if you plan to receive 5 naira for a particular drug, should it be imputing 5 naira plus 20%, so that when CloudClinic takes its 20%, you get your 5 naira? The answer is yes. The figure you put in there, we will be deducting our percentage on top of that. So, however, we are not, because remember that this platform is also driven by market forces. So we advise our partners to make sure that they put prices that are reasonable at the end of the day. When it's not about inflating the prices, because patients will see these prices and determine which pharmacy to buy from. So the same way you would determine the right prices, within your own facility for walk-in patients, also try and make sure that those prices reflect the same thing on the platform as well.
All right, thank you. Afolakemi Gold, I hope your question was answered. So very quickly, we would like to give some of you the opportunity to be able to ask your questions. So if you would be interested in asking a question or making a comment, you can raise your hand and then we give you the permission to actually speak. Also, if you still have questions, you can leave them in the chat box and then we'll attend to you. Okay, Afolakemi Gold says, do you have an estimate of anticipated patient load?
It's difficult to say. Anything we say right now with mere speculations. We're planning to launch on the 18th of April, but we have some very clear marketing plans. Unfortunately, I can't disclose that today. We believe the load will be great. We already seen a serious anticipation in the market. We have about 120 something patients already pre-registering for our platform, even without it being launched yet. And we believe a lot of people would want to do this. There's also a lot of conversations with different companies for retainership, and they were having conversations with HMOs as well, to come in onto our platform as well. Those conversations are ongoing. So we believe the actual patient load will be very significant to make a major dent on your traffic if you're a partner with us.
All right, thank you. I hope your question was answered. So I'm not seeing anybody's hands up. So that means nobody wants to ask their question live or give any comment. So we can begin to round up. All right, thank you to Afolakemi. Thank you very much. So thank you everyone for taking the time. The attendees, special thank goes out to you. So if you've partnered with us already, we'll be sending out several follow-up links to you containing our house rules, containing the slides. I've seen that Darlington Pharmacy has requested for the webinar slides. So we'll definitely be sending that out to you as well. Okay, I can see that Chika Ogugo has his or her hand up. I would request for the host to give this person the permission to speak. Thank you to Adamo. Thank you, Darlington Pharmacy. She says, great innovation. Thank you very much. All right. Okay, Chika Ogugo's hands is still up. Can the host kindly give this person the permission to speak? Okay, you can unmute yourself and speak now.
Chika, you can just unmute and then you can speak. I think you have the mic now.
Okay, hello. Good afternoon, everyone.
Good afternoon.
Okay, really, I'm glad to be on this platform. Listening to all you have said, and I must commend you. You did well. We look forward to joining you to move on with whatever you have set out. But I'm also thinking about the price list thing. I was trying to type before anyway, but I wanted to find out how often can you update your price list, knowing that nowadays these prices can change like morning, afternoon, night. You can actually have a different price change. So I'm just worried, how often can you change your price list? Because if
Thank you.
Yeah.
Sorry, go ahead. I thought you were done.
I was just going to complete by saying that, if you have prescribed something for a patient and the price changes and possibly something that you just got like immediately, how are you going to be able to work on this different price difference? Yes.
Okay. Thank you very much, Chika. Interestingly, this is something that we've some concerns that a lot of people have raised, and we built that feature into the system from the ground up. What am I saying exactly? You can update your pricing anytime. There is no limit to how often. If you want to do that every second, you can. With a partner app, you can change prices easily. You can do it one by one as the prices are changing, or you can also upload anytime you want. You can re-upload. And what we have done, because we know, we're in Nigeria, and then we know how inflation hits things and things changes. Price of petrol goes up today and everything just start getting more expensive overnight. We've made it possible for you to be able to upload your template or your prices on our system. And in addition to that, to make this very easy, we also made it such that you don't have to even work with a separate template. Because one of the conversations we're having with some pharmacies, when we're discussing these features, was that some of them were saying, hey, it's going to be a lot of headache maintaining two different templates. They have a template they are using today for for maintaining their inventory. And then, if we start asking them to change, maintain two different lists, will be a problem. So what we said is that you can bring your own templates, the same template you're using today. All you need to do is to change the header, right? To let our system know which one is your price, which one is your, brand name, which one is, formulation, and all of those things. Once you indicate all of those things, our system is able to receive that and update our system. So we've made it very easy. You can upload anytime you want as prices change.
Okay, thank you very much for your comments and your questions. I hope your question has been answered. Okay, Sir, that is actually one of our partners. I just found that she's from DoveMed Pharmacy in Enugu. Thank you very much, madam. We also have one of our partners, actually, Turmeric Pharmacy, which was Turmeric Pharmacy was heavily involved in our experimental consultation. Thank you very much, Mr. Tulu. Fam Chinedu is also here, one of our partners as well from Kamen Healthcare. Thank you very much for joining us, everyone. So we'll be rounding up now. So like I was saying earlier, we're going to be sending everyone the webinar slides, the link to download the app as well, the partner app as well. And then as soon as you're created from our end, you will be able to start uploading your price list, and you will begin the activation of your facility on the partner app. But you'll definitely be hearing from us. You're hearing from me in particular. Thank you very much, Priscilla, too. All right, thank you very much. I'm going to be using this opportunity to appreciate all of our panelists, my able CEO, Mr. Ifeanyi Aneke. Thank you for joining us. Flourish Nnamdi, our product manager, Dr. Amy, our clinical director, as well as those behind the cameras. That's Ejiro, our business development manager, and our digital marketer, of course, Busola Oyedepo. Thank you very much. And also to our engineers, thank you very much for putting this together. Okay, somebody just dropped a comment Mr. Steven says, for me, the issue of price is the prerogative of the partnering pharmacies.
Yes, so I'm not sure if that's a question. Definitely it's a prerogative. And that's why we've made this very flexible, so that you can set your own prices. We understand that we can't dictate prices of drugs. Every business has their own costs. And have a target market they are focusing on. So some pharmacies are targeting, the affluent and the wealthy, and because of that, they will position their pharmacy in, choice areas that is in close proximity to those places and furnish the same way as well. So what we have done is to make it possible for you to come with your own pricing, and then based on your pricing, the people that like to work with you, your brand, you will be able to reach those kind of people on our platform. So yes, we agree. It's definitely a prerogative, and we've made it flexible for you to be able to decide what your own price would be for your business.
All right, thank you, sir. So if we sent you the partnership documents, hopefully we'll be getting your signed copies before the end of the week. But if we've not sent it to you, you can reach out to us, partnerships@cloudclinic.ng, and we'll definitely be sending it to you. And then you can sign and become a partner as well. So let's just take one last question. They said, who has the responsibility of sending a patient to a specific pharmacy?
So the patient makes that decision himself. The doctor has visibility using our GPS technology to tell the drugs that are close to the patient and the brands that are close to the patient. But the patient would decide. So on the patient side, we normally will present the different pharmacies and the drugs that they have, and the patient will determine where they want to buy from. So that decision rests solely on the patient, not on the doctor, not on CloudClinic.
All right, thank you. I hope we're able to answer all of your questions. Thank you very much, everyone. We'll be in touch.
Thanks, everyone.
Okay, somebody.
Okay, keep going.
Okay. Somebody's hand is up, actually. I don't know if that was a mistake or if the person is trying to speak. We can give this person the opportunity to be the last person to speak. Farm OBD. Sorry if I'm pronouncing your name wrongly.
Okay,
yes.
Thank you very much. Okay, please, my question is, thank you for the online program. I'm happy to participate. My question, as we're about to round up, my question is, assuming if any pharmacy has multiple locations, can you have the multiple locations in your, maybe your consulting or your website, so that the patient might choose, depending on the patient's convenience, where to go? Am I clear now?
Yes, you're very clear. We have a lot of pharmacies. The short answer is yes. We have a lot of pharmacies that, partnered with us already that have multiple locations. And the system allows that. In fact, we give you a way to manage all of those things from one app as well. So you can manage the pricing, price uploads, and all of those things from one app. That is fully supported, sir.
Okay, thank you very much, sir.
Okay. You're welcome. So, Lola, I think there's one last question on the chat from Afola Kemi. I think it's a question. Can you read that?
Yeah. Yes, it is a question.
Yes, I think what I'm seeing here is the patient makes this decision solely on location and or cost of medication to be picked up. So yes, the patient makes the decision, like I mentioned earlier, and yes, he will look at those things. It's actually those two factors that determine whether a patient would choose to buy from a particular pharmacy. Some patients will be looking at the app tells them the distance between where they are and where the pharmacy is, but it also tells them the price. So if a patient will now decide, okay, does he want to drive to that place, or would he go with one closer that may be a little more expensive and things like that? So it's really a decision of the patient to determine what he wants to do and how he wants to go about that. Yes, that's how it is.
All right, thank you. And on that note, we'll be calling it a day. You'll be getting follow-up emails from us, like I mentioned. Thank you very much, everyone. Enjoy the rest of your day.
Yes. So, and for
Alright.
any of our pharmacies, any of the prospective pharmacies here that want to partner with us, we'll be sending you a link to request for partnership. But you can also email partnership@cloudclinic.ng as well. And then we'll get back to you with the partnership forms. Thanks, everyone.
All right, thank you so much, sir.